Last night, President Akufo-Addo announced the resumption of academic work at all school levels across the country.
Even when the vaccines arrive in Ghana. By observing these protocols strictly, we're also making sure that the imposition of crippling restrictions and lockdowns do not become options for government. Until then, government, in consultation with the appropriate stakeholders, will continue to pursue a strategic, controlled, progressive, safe easing of restrictions, this time in all public and private basic schools, junior high, senior high, and tertiary institutions across the country, beginning this month of January. The lessons drawn from the reopening of some sections of our educational institutions in the course of last year have put us in a much better position to oversee successfully the full reopening of our schools. Our children must go to school, albeit safely. We are satisfied that in the current circumstances, the reopening of our schools is safe. So from 15th January, our children in kindergarten, primary, and junior high, in both private and public schools, will be back in school. All SHS1 students will start classes from 10th March, with all his students embarking on a single-track academic calendar. Their seniors in SHS2 and SHS3 will, however, return to school from 18th January. I must stress that SHS3 students in all schools, like SHS1 students, will no longer run the double-track system. The expansion of infrastructure at the various senior high schools over the last 3 years has brought us to this favorable situation. However, the double-track system will still be applicable to SHS2 students in schools that are employing it. Students in universities and other tertiary institutions are to be in school from Saturday, 9th of January.
That's President Akufo-Addo last night. It brings to an end 10 months of closure forced by the outbreak of COVID-19 in China, which has since spread to the rest of the world. Starting from the 15th, kindergarten, junior and senior high school students will now be able to access education in the classroom. So how safe will that be for the different age groups? That's our top story today. Our panel of experts will help us explore this subject in detail when they join us shortly. But we have public health expert Carlos Tego, who is a deputy education, we also have the deputy education minister, Dr. Yao Educhum, Executive Director of Child Rights International Right Appear, as well as the President of NAGRAT, Angel Kabono, joining us. Now, that crack panel will help us deal with this all-important subject of school resumption here in Ghana. First of all, let's take a look at some of the protocols that government has announced it is putting in place.
Prior to their return to school, government through the Ministry of Education and the Ghana Education Service will ensure that all institutions, public and private, are fumigated and disinfected. Schools and institutions with their own hospitals and clinics will be equipped with the necessary personal protective equipment and have isolation centers to deal with any positive cases. All other schools and institutions without their own clinics and hospitals have been mapped to health facilities. There will be, for now, no mass gatherings and no sporting activities. However, religious activities for students at school under the new protocols will be permitted. Social distancing and the wearing of face masks must become the norm in our schools. The requisite provisions have been made to ensure that students at all levels of the education ladder receive the minimum number of contact hours upon their return to school. To facilitate the safety of students, government through the Ministry of Education will provide face masks, Veronica buckets, hand sanitizers, liquid soap, rolls of tissue paper, and thermometer guns for the safe reopening of the schools. The Ministry of Information, the Ministry of Education, the Ghana Health Service, and the Ghana Education Service will, from Monday, 4th January, commence a series of sensitization campaigns to help prepare, inform, and educate guardians, students, and the public on further modalities associated with the reopenings.
At the Education Ministry, some of the officials have been telling us how this will pan out. We'll tell you what my colleague Maxwell Akbaba gathered on the location. But on Zoom with me now is Dr. Benedict Kalis Tego, who is a public health expert. Hi, Doc. Good afternoon.
Hello, good afternoon, and good afternoon to your chair.
Let me take your preliminary thoughts on our new situation. I mean, right now we're going to school, whether we like it or not, and whether parents like it or not, they'll have to take their children to school. You've heard also the protocols that government says they've put together to ensure that our children are safe. What are your thoughts?
Well, it's a mixed feeling. Personally, I think the decision by government to reopen schools is a very bold one, which needs to be commended. I mean, considering the fact that nobody knows for how long COVID is going to be around, and we cannot put education on hold forever. So I think it's a very bold decision that needs to be taken. The important thing, however, is how this is all implemented. So a lot will depend on how this is rolled out. And I would be looking forward to guidelines and directives from the Ministry of Education and the Ghana Health Service in that regard. But I think it's a very bold decision for the president to ask for reopening of schools. I think the president's call for schools to reopen is a very bold decision which needs to be commended. We do not know how long COVID-19 is going to be around, and we cannot suspend education indefinitely. So I think it's a call in the right direction. It's been done in other jurisdictions. However, what needs to be done now is to monitor the implementation. How exactly is this going to be rolled out? And I said I'll be looking forward to more specific directives and guidelines from the Ministry of Education and the Ghana Health Service in the days ahead. Because as we know, we have public schools, we have private schools. And my concerns would be with effective monitoring of whatever directives are given, considering the fact that ever since COVID started, we have had policy directives. But unfortunately, even though these directives were in the right direction with good intention, the implementation leaves much to be desired.
Talking about implementation, we'll be going through the calendar and then the new calendar that the government has put together, hoping to deal with the problem that this situation has created for us. But if I were to ask you, Doc, in terms of class numbers, what would be your recommendation? Because parents seem to be worried that it's good to go back to school, but with, people don't seem really serious about the COVID protocols. So putting children back in school and looking at the number of people that we have in a traditional Ghanaian classroom, there are concerns that that could even endanger the lives of students and open them up for infection.
Thank you very much. I honestly share those concerns about class sizes. We cannot give definitive numbers for each class because the sizes of the classrooms will vary from one institution to the other. And that is why I made that earlier comment that I would be interested in the fine details that the Ghana Health Service and the Ghana Education Service and the Ministry of Education would communicate to the various schools, especially with the private schools. Because we cannot go back to school and cram 80 students in the usual class sizes. We need to look at all these vis-a-vis the preventive measures. How can we ensure that there will be social distancing in the class? How can we ensure that there will be effective wearing of face masks in the school premises? These are things that we should be looking at. And I think each school would have its unique challenges. So it would be very difficult to give a blanket directive. But we would need to monitor this on a case-by-case basis to determine what needs to be done. Because there are schools that have class sizes in excess of 80 or 100 students per class. And I know of schools that usually have class sizes of 30 and 40 pupils per class. So we cannot give the same directive to these categories of schools who have different sizes. So it would be interesting to know exactly the plans that the Ghana Education Service has in mind. And then we can either make inputs or otherwise to those directives.
Look, what I'm going to do is that we have the Education Ministry officials have announced the rollout of some wide-ranging measures that is supposed to ensure that they go back to school and do so in a way that will help them catch up as well. I want to take you through that calendar. I will try and explain to you some of the things they're saying. I don't know if you yourself have seen it, but this is it looks like a PowerPoint presentation put together by the Education Ministry, and it talks about how the semester or how the terms are going to look like. Let me start with, I'm going to start with the SHS, the calendar for the SHS. Now, if you're looking at your screen at the moment, we're seeing January to February as the period within which senior high school 3 students will be in school. So SHS 3 students will be in school between January and February. By March, they will be on vacation. And then they come back to school in April to May. In June, they go on vacation. In July 2021 to August, they go back to school. In September, they write the West African Senior West Africa certification exam, and then by November, December, they would have ended or finished school. They're supposed to, within this period, finish with contact hours of 1,080. I mean, these are more education, so of course you're more of a public health expert, but I just wanted to take a look at this. We'll be talking to the other panel members who will join us subsequently. But if you look at the first semester, that is for the senior high school, and then the green colors that you see there represent senior high school 2, that is SHS 2, and for the green track, they will be in school between January to March and go on vacation in April and May, come back to school in June and stay till August, go back on vacation in September and October, and go back to school in November and December. And then the same SHS2 students will go back, who are at this point on the gold track, will go back to school between March and June. They have vacation between July and August. Then they go back to school in September to December. For the final year, for the first year students who will just be admitted, they will be in school for March. In fact, they will be admitted from March to June, and then from July to August go on vacation, and then from September to December they will be back in school. From a public health perspective, is there anything you can share based on this particular calendar?
Well, there isn't much to say by just looking at the calendar. The calendar just tells us the contact hours that these students will be in school. I think the most important thing is the modalities that are implemented whilst they are in school. I can say for people who would be in the boarding house, it wouldn't be too much of a difficulty because they are in a closed environment, and therefore the issues to look out would be the teachers who would be moving in and out, and if there are day students, the day students who will be commuting between the home and school. And then what measures would be in place when these people arrive in school to ensure that they disinfect before joining their colleagues? Then the other thing to look at would be the actual contact hours in the classroom. It would be advisable to have a lot more frequent breaks so that people are not kept in the classroom for prolonged hours. And we should also look at, for people who would be in the boarding house, now that we are going to have a full house, what arrangements are going to be put in place? For instance, if they have to go to the dining hall, what sort of arrangements are going to be put in place to ensure that there is adequate social distancing? If they are going to have church services, now that the president says religious activities can't be allowed, what modalities are being put in place? So it's the fine details that would actually help us to understand exactly where the dangers will come from. But I think that just looking at the contact time, adequate, and I wouldn't have anything to say unless I know the fine details of how these things are going to be implemented.
Okay. Dr. Hang for me, let me bring in Angel Carbonu, who heads Gov't, who is joining us also via Zoom. Sir, thank you very much for your time. Good afternoon.
Hello, good afternoon.
Mr. Carbonu, right, good afternoon. So I was just going through the sort of the changes that we're seeing in the calendar at this point with Dr. Calistego, who is a public health expert. And I'm sure that as teachers, you have your own concerns about the safety.
Yeah, well, let me start by saying that the semester program for the junior high school, per my understanding, is for the solution of this emergency. It is not a permanent feature. That is my understanding.
Okay.
The meeting I held with the Director General.
Okay, Mr. Carbonu, so you're jumping a bit further into our discussion, but that's okay. We can focus a bit on that. Now, you're talking about the change from the trimester to the semester for the junior high school.
Okay, let me get your specific question so that I answer it.
So because I was talking to the public health official, I wanted us to focus a bit more on the concerns that you have and whether or not those have been addressed in terms of the protocols to make sure that students return to school, but it's done safely.
Okay. Well, we are yet to go back to the schools, and per the promise of management, those materials to ensure the adherence of the protocols will all be provided, and they'll be provided adequately. So we don't have any worry. The only issue is that when the schools reopen and we realize that the materials are not there, we will raise concern and raise the red flag, because we are talking about lives of both teachers and students in this case.
Okay.
That's why we are saying that management should ensure that the various materials to ensure that adherence to the protocols are there in the schools.
Okay. On the back of that, as a public health person, he has also raised concerns about class numbers. Are there any guidelines as far as class numbers and how many people are supposed to be in a class at a given time, and how long teachers are supposed to be, the students are supposed to be in a classroom at a given time?
Yes. The class sizes is a concern. And what happened the last time before December was that whenever you have a class size that goes beyond 30, you will have to form another class. This time, looking at the numbers, it will create a challenge, because that also talks about space, whether the space is available for a new class to be created. Again, like the public health personnel said, I don't believe that in this time we have to keep students in the classroom for a very long time. And this is where I think that off the cuff decisions, taking decisions on your feet as manager of education or in an educational unit is very, very necessary. If I'm a teacher, for example, I will want to have more outdoor classes than indoor classes. I'll bring the children under the trees in the schools if there are, or the shed in the school if there is, so that we can have classes there and minimize the possibility of confinement within the classroom. Again, when you talk about dining halls, all students converge in one dining hall to take breakfast, lunch, and supper. Can we begin to think of the CAF and change modalities quickly and not wait for somebody to come and issue directives? What can we do so that we don't congregate students in the dining hall in such a manner that there could be possibility of infection? When it comes to religious worship, can we ask the children to move into their various classrooms and have some short prayers within 30 minutes than the congregational type of worship that goes on in the school? You don't expect the Director General of the Ghana Education Service or the Minister of Education or the President of the country to come to your school to give you this specific directive. I think that school management themselves will have to sit down, looking at the nature of this disease, to take decisions so as to ensure that there will be no spread of this disease.
Okay. Perhaps sometimes it's an issue about standardization and making the guidelines available for. You have said that they have to be able to think on their feet. But what if someone can't think on their feet? What happens to the children? So perhaps.
If you can't think on your feet, then you are not free to be a manager of a school.
No, I mean that's just a hypothesis that I'm creating there. What if it's a what if question? Okay. So would NAGRAT and the other associations, for example, think of some sort of standardized guidelines that can support in the implementation of these?
Well, standardization is good, but you realize that infrastructural availability, nature of the school compound and environment is very school specific. Which secondary school did you go?
I attended Ashaiman Secondary School, by the way.
Okay. Now, when you look at Ashaiman Secondary School and where it is located, and I know that school very well, you realize that the geography of Ashaiman Secondary School is totally different from that of Tema Secondary School.
It is.
The facilities of Ashaiman is totally different from that of Tema Secondary School. Mm-hmm. So when the headmaster of Ashaiman Secondary School is going to take certain decisions, he is going to take the decisions specific to Ashaiman Secondary School, different from Tema Secondary School. You see, we are not in normal times. We are in times that we try as much as we can to provide education to the extent to which we can provide it. Okay. So that we don't have a vacuum and also a suspended development and growth of our students. That is what I'm talking about, looking at your situation, taking decisions to ensure that you protect your situation. Life, teachers and students.
Very well understood. So now let's come to the semester and the academic calendar and the changes that we're seeing. Perhaps we can start with the senior high school. Do you have any concerns about the changes there as well? Because apparently there are a number of contact hours that have been lost. And to be able to meet that number, there has to be some adjustments which have been made.
Yeah. Yes. Look, the issue is that if we were in normal times, you know very well that the unions were going to kick against this type of timetable. Or this type of calendar, you know very well. But this is also not the time to be going to kick against models and all that, because this model is a short-term intervention to solve a problem so that we can all get back to the state of normalcy. For someone to go to school 2 months, come back home, go to school 2 months, it's not the best. But again, we are saying that it is because of the times. In one way or the other, you will have to manage the situation. Okay. I am a teacher and at the same time a parent. And I will advise that if you think that this calendar as it is going to be the ultimate solution to the knowledge acquisition of your child, to prepare the child to write an examination, I will say hello. I will advise parents so that when the children are at home, they get the children some instructors for them to help those children. Again, one thing in this country, and that is creating the problem. If we had had a strong ICT base where we are in full throttle with our ICT, while some students are at home and others are in school, especially those who are doing double track, there could still be instructional communication between teachers and the students. My union have taken it upon themselves that going forward, we are going to encourage all our members to become ICT compliant within the shortest possible time. We have even asked our members that even your lesson note preparation and all that should be ICT based. If we were having that, this problem wouldn't have been a problem. Unfortunately, we don't. So again, I don't know how far government have gone with the provision of the Wi-Fi in the various senior high schools. I want Joy FM to check on that on behalf of all Ghanaians to see whether, as promised by the Vice President, whether the Wi-Fi's have been fixed in all senior high schools. This is also going to help ensuring that we can communicate with our students. So the timetable is not the best. The timetable is not a solution, but in the current circumstances, we are prepared to work with it.
Let me bring you were talking about the JHS bit, where there is a shift from the trimester system to a semester system. So schools are supposed to be, junior high schools are supposed to be in school from January all the way till May. And then in June, they go on vacation. They come back to school in July and all the way to November. They write the BECE in November. For JHS2 is the same thing, it looks like. JHS1, the same thing as well. It's for the JHS3 students who will be writing the BECE in November. Yeah, you had a point on that one earlier. Mr. Kabonu? Okay, so Angel Kabonu there, he's representing NAGWAT for us in this discussion. But let's hear from parents on this reopening.
As a parent, I personally am prepared and I'm ready to give anything that my children may need to go back to school. But my main concern is how prepared is the president too? Because we are not seeing any expansion of old schools. We are seeing only the old buildings, and the students that are they going to separate them to various schools? And how is that going to be since we are not seeing new developments? Because the school that my children are going like this, I'm not seeing any new developments. I'm not seeing any progress. So when they happen to resume today, my children going to be in class like 34, 32 as they used to be, because there is no expansion going on in the school. I pass there every blessed day, no expansion. So actually, we the parents, we will be ready to do everything to support our children.
Okay, as a parent, I'm not ready for my child to go to school because I feel my child is too young. Looking at how kids are, and then in their class, I think they have 2 teachers. But with their number, I don't think they can be able to observe the protocols as the president wants everybody to do. Even in town, you can see some are wearing the face masks, others are not wearing. You see kids running here and there, and to me, I feel it's not safe.
Since the COVID took place, there are so many measures that you're supposed to put in place. Maybe there should be a provision of nose masks for the kids, and then every class, depending on the school that the kids find themselves, they should be able to minimize or reduce the number of students in the class. And the president should also ensure that in every school, he will send people around to supervise whether all these things are being put in place to ensure the safety of our kids.
I think the school need to reopen school. And since COVID nearby, and I'm like financial difficulties and stuff aside, and also no in Kuala 80 fear no me who say emboa, because if you have time I go school regularly at the end of the day no result never by 90%. Now yet if na online is me no bia na bet me nyesika, because me say me wo fie salary issue na ba form into me dey anto bundle e dey ama akwala na with me access online education. And I think so mu bie a ebeboa.
Ake president ke ba agbelegbe ni be ke bia school. Kwe won suma ke egbele ni be ke bia school ake anu kwale ni be ke bia ba hyen ya nto. Ye fo ye wo be de kan ta flache wo ke yin fo. She am a John one was Georgiana me kwe. She anwa. Bomonchuni ekwaka nyongbe boy apekole. She wa mele kefe to mo faith traders. No what chuoni. Beke bi won shu amehia. E won no shu amehia. Ka amehia ba me hwehwe mo nei. She school ke ka na gbele na mete. Chose me ba jeme. Teacher say wala ka me no ame wawo. No kwa wo biye. Kaloko ye na ba fe de fomo ne. E ka beke bi ba ya skit gbe no ko ke ka ya ya. E wa anu kwale hia mo beke bi ba anu kwale ehi. Won kpafai Koniani beke bi abon school ya. Ka mete school ba wa ye 4 year wa.
Ye nta be to obi school ni se. Ye mane tifia e wo me se ye sua o mu sua de na nso on be bon. And school no so de eboa. Nya aduane ne de ene wo we gale kura banku ni mako batimi awe. Awe ne saa ke ka ada. Na ehia sa akora ne be ko sua de. Ye nom yanti mi anko school ni bi. Ene ti na ye force say ale ane wo ho mom de. Nanso ye mane beti ha ba school. Ama teacher for na mo wo ho no. O beti me protect ye mane ye. E wo school mu ho. Sa akwa ne fa ne sanko to fam. Ni ma me de sanitizer ba sha ne bag mi na. Wonya ne basa basa.
Some parents there, I'm having this conversation with Angel Kabonu, who froze on us a short while ago. But Mr. Kabonu, I do have you back. I was waiting to hear your thoughts on the JHS calendar, which is now more a semester than a trimester.
Now, can you hear me now?
I do. It's a bit unclear, but let's try and see.
Okay. Am I okay?
Yes, please go ahead.
Right. I'm saying that if it were not times, will be the reason for JHS should run a semester program. Because what it means is that the semester program keeps students in one particular time in a school for a longer number of days. Looking at that age bracket, whether the semester system was going to be okay. But that is why I said that we are not in normal times. So, and then we've lost a lot of time, especially for those who are going to HS3. Therefore, these are interventions to be able to solve the problem as best as we can, and we are ready to go with it. The only issue here is that let us ensure that all that is promised to be provided are provided so that the teachers can also be versatile and do that they can do.
But what problem could there be? I mean, assuming we're not in the difficult times you describe, if students have to, I mean, JHS has to be more of a semester rather than a trimester, apart from the number of days you mentioned that they'll be in school.
Well, with the semester program, you pick a course and a program and you exhaust it within one semester module. But when you look at education down there, you don't exhaust courses within program module.
I'm losing you again, Mr. Kabunu.
That's accumulated.
Let's try this again. So you were saying, my question was whether or not, apart from the number of days that students are expected to be in school, there's a problem again.
Okay, I'm saying that in a semester program, you exhaust one course within a module, and sometimes you don't even go back to that course again. But in the type of system we run at the business schools, you accumulate information and knowledge so that they all go and write that in final exam. That is one problem or challenge that I see with the semester program at the basic school level.
Okay. I'm sure that there's a possibility of tweaking it to make it better and to deal with the problem that you're raising. But Mr. Kabonu, just hang on for me. Let me bring in Brighter Pierre. He's a child rights advocate. Mr. Pierre, thank you for your time and good afternoon. Now, if you look at the semester, the calendar that we have here for kindergarten and primary school, for example, they're sticking to the first, the trimester. So we have the first term, the second term, third term, etc. You've done some work about the impact of staying at home on the lives of the children. So certainly this comes as good news, doesn't it?
Yes, of course. Opening schools is a good news based on the work that we've done so far and some of the issues that children are confronted with. So on the basis of that, I think that it is a good news. But though it's a good news, there are other things that must also be put in place to make it a better news for all of us. So we are anticipating that those things will be put in place. And then also, you will see clearly that based on the announcement and then the press conference that the Director General held, you clearly see that there are some changes that are going to happen, and we want to see how those things are going to unfold.
Okay, Mr. Appiah, let me just jump in. Sorry, let me just jump in there. I want to bring in the Director General and what he said, since you've mentioned him, so that the other members on the panel can also, listen and be on the same page. So let's take you to the Independence Square earlier today, where they held a press conference. The Director General of the Education Service has been speaking.
This time round, JHS will be running semester program. JHS will be running semester program. As we have always done, we make sure that the basic protocols are observed. So there will be disinfection of all schools. There will be provision of Veronica buckets, soaps, hand sanitizers, and tissue papers to the schools. We will also provide the washable and reusable face masks. And then schools will not be available for outside activities. We will also continue with our online TV and radio programs to support teaching and learning. Way back in 2017, we worked with Ghana Health Service to map out health facilities in the districts, in the regions, in the towns, in the cities for our SHS schools. Again, we also ensure that all our schools have some sick bay facility. And this arrangement is the one that the President talked about. We are still going to ensure that the mapped schools and then the primary and the JHS schools are also mapped to health centers. Now we have health centers up to what we call chip compounds and all that. So that is an arrangement that we're working with health to make sure that we improve on it. On the issue of flouting of restrictions, we've had 2 phases of school reopening, and we are glad to say that during those 2 phases of school reopening, there were no major issues of flouting of restrictions. But if for any reason a school flouts the restrictions, there are ways of dealing with that. Not only these restrictions, but all school regulations and things like that. When schools flout them, there are regulations that cater for that.
So that's Professor Kwesi Opoku Amankwa, the Director General of the Ghana Education Service. Was actually speaking at a separate press conference. We'll take you to the Independence Square shortly. So, right, back to you. He talks about all the things that have been done to make sure that the schools become safe. He talks about disinfection, provision of Veronica buckets, reusable face masks that will be provided for the children, not allowing people, into the schools for any activities, online and TV radio programs, which will continue. And then they have mapped the schools up with health centers. Good, isn't it?
Well, it is, but if you look at the whole arrangement, adjusting the calendar to run it at the semester, even at the JHS level, I personally feel that there's a lot of work that must go into it because of the way we have restructured our examination system. From the policy point of view, it makes sense to them because, one, the opening in January will let them run the whole year, which would also correspond with the budget allocations of government to the ministry, so that when there are any other issue, they can make provision for it, so that they can run it within the in line with our budget allocations and all that. So they have achieved a purpose with that. But you should also look at the end of that design, that the way we have structured our examination in this country, you'd have to run the system for a while, till the end of it, in order to run your exams. So it means that children are going to spend more than 5 months in the classroom before they go and write the examination. But we've not also done any assessment to find out whether or not that would be applicable in the minds with the children, and how, so that we can run it properly. So that assessment was also missing. Again, the one thing that is also missing has to do with the fact that during the school closure, Ghana Education Service and its Ghana Health Service did not take any steps to sensitize the children who are at home on observing protocols, knowing that schools will open in January. So we have not prepared the minds of children to get back to the classroom. And this is one aspect is psychological, and that also the other aspect has to do with how they are going to comply with the protocol measures that are going to be put in place and all that. So there's no preparation whatsoever for the nursery schools, the primary, and then the GHS. So these are issues that, for me, that must come to the table. So we should not always only look at the physical provisions that they are going to give as a response to the protocols, but how the behavior of students are also going to have a bearing on the usage of the material that is going to be given to them, so that we don't have a situation where children would go to school, forget about themselves, and then use all manner of means to engage. Because once they are going back to school, we should know that this is the first time some of them are going to meet their friends, are going to meet their colleagues. So the entry point, the socialization aspect would also kick in. But if you don't sensitize them very well for them to be aware of the situation that they find themselves in, some may forget themselves and then embrace each other, have interactions that will promote some kind of socialization, which, because we have not prepared their minds, these are the things that are going to happen. So I don't want us to solely base our minds on the fact that because Ghana Education Service have provided the logistics for the reopening of the schools is enough. I think the question that we need to ask them is that how have they prepared the minds of these students to be able to even use the facilities to adjust to the new system that they have taken advantage of, to adjust the calendars that they are going to run for the year. So these are things
let me just jump in there.
Okay,
let me just jump in there. I want to bring in the public health expert for his perspective on what you have just said. So, Dr. Carlos Tego, you've heard all that he said. I would have said that the students seem, I mean, if you talk to most of them, they seem to be eager to go to school. So in terms of their psychological readiness to get to school, it's as if they've always been in anticipation. But the point Bright is making is that the absence, from, not seeing each other for a long time will make it will make them more amenable to now wanting to socialize in ways that could spread the virus, should any of them have it. From a public health perspective, what are your thoughts as I conclude with you on that?
Well, I think Bright makes very useful remarks in that regard. And let me share some personal experience with you. I am a lecturer in the medical school. Now, when the universities were asked to return to complete their academic year, what we did was to organize an orientation for each class as they came in. Now, even before the orientation, whilst they were being asked to wash their hands and get their temperature checked, you just look around and the excitement, people were hugging each other, people were jumping in groups. So it's a natural thing. And that's where the psyching up, that's where the education comes in handy. If people have been prepped up to know that, one of the reasons why we've had COVID spreading, and if you look at the current trend, it's spreading in close societies. So you have families. You have a family, maybe 6, 7 people in one family. And that is because of what we'll call familiarity. Oh, I know this person. He's my friend. He can't have COVID.
Yeah.
Oh, that is my best friend. He doesn't look like somebody who has COVID.
It happens to all of us, doesn't it?
the issue of familiarity has been one of the biggest bane we are dealing with. So if people are not properly psyched up and they get into the school environment, I mean, what would be your natural reaction if you meet a friend you haven't met in a year? You know, the natural thing would be you want to hug, you want to hang out, you want to. But
so at the level, so at your level where you're dealing with medical students, you had to do orientation. But for kindergarten, children in kindergarten and those in primary school and junior high school, what recommendations are there from a public health perspective?
Being in kindergarten doesn't mean you can't give an orientation. It is the contents and the modalities that you adopt. There is the same way you can convey this message to a kindergarten 1 or 2 people for them to appreciate it. They may not really comply as the adults will, but at least some of them would have an understanding of what it means to stay away from people.
Okay.
I mean, I have children in both primary and JHS, and ever since COVID started, people have been accusing me, what have you been telling your children? Because even when I take them out, they are more concerned about safety than sometimes I am myself. I do something and they would have to prompt me, but why are you doing this?
Okay.
You know? Okay. And it's because of the education and sort of conversations we have back at home. So it has become like second nature. So I believe that parents have a role to play. We can't leave everything to teachers in this regard. Okay. We can't expect Ghana Health Service or Ghana Education Service, or for that matter, government to do everything for us.
Give me your concluding thoughts. Your concluding thoughts on all the conversations that we've had and the bits and pieces, and your advice as you were just putting it to parents, especially.
Well, so I think going back to school is a good idea and it's necessary, but then everybody has a role to play, from parents to teachers to managers of schools. And I would be looking forward to a situation where schools will be tasked to come up with the modalities they are putting in place for these to be inspected before they are allowed to reopen. And following reopening, I would expect that there would be a task force that would go around to check whether schools are really complying with these modalities. Because if we look at past directives that have been given, a lot of them have been flouted with impunity, and no measures have been taken to, punish or bring these people to book. So people flout it, people go about without wearing masks. Beaches are supposed to be closed, but we are having beach parties. Pubs are supposed to be closed, we are seeing them opened. In the full glare of the public, nothing is being done. So my only hope and prayer is that as we open up schools, we would put in measures to effectively monitor so that these regulations or preventive measures will be strictly adhered to.
All right. Doc, thank you very much for your time this afternoon. Dr. Calistego there, he is a public health expert who joined us, for this discussion. You've heard what he has to say. Parents have a role. All of us have a role in keeping our children safe. Bright Apia is still on the line with me. It looks like we've lost Angel Carbon, who would have taken his concluding thoughts as well. But Bright, now we're looking at, latest January 15, we're going to, a section of the students are going back to school. From your office, you have talked about the fact that we haven't really done a lot of work about the psychological preparedness of our children there. Is there some work ongoing, or is this something that an idea you sell to the Ghana Education Service to pursue?
Oh yes, we've been having a backdoor discussions on how to move this process forward. And I know Ghana Health Service is also helping the schools to have some kind of information available. But I'm just looking at the time, whether they will be able to do it. Because as we speak, once we open school, from now to March, we're going to have about over 9 million children who are going to be in school. So it means that our programs and activities must also be at a certain level where it can meet the needs of over 9 million children who will be in school and all that. So we are hoping as organization, we will still continue to do what we have to do. But We think that the system must also be very responsive so that the teachers would also be there in the school to provide the kind of knowledge that they need. Parents must also assist their children at home to be able to obey the protocols. Because the point is that based on the research that we have done, the effect of COVID amongst children is not as dangerous as compared to the vulnerable groups or the adult population. So that is the good news out there. But what we've not been able to determine is whether or not when children get COVID, they can easily transmit it to the adult population. And that's where the danger is. So it will be in the interest of the adult population, in this case, the parents and teachers, to also ensure that children follow the protocols so that they don't become vulnerable to children when when children get the virus and all that. So whatever we have to do as parents and as the adult population, it is to our advantage to ensure that children follow the needed protocols so that we the adult population do not become vulnerable to children. So let's all of us play our role. And moving forward from next week, Monday, we will roll out some activity to also provide some education to our children as well as parents on the school reopening and how they have to obey the protocols.
Right, thank you very much for your time this afternoon. Right up here there, he's Executive Director of Child Rights International, and they are into children rights advocacy. Let me take you now to the Independence Square, where government said has been briefing the media on preparations for the reopening of schools. Maxwell Agbagba was there for us as the equipment for disinfection programs was displayed.
We also have drones, and these drones are also used in sophisticated areas, in an area spraying where we cannot use this electrostatic machine. So we have these drones, yes.
An official of Zoom Lion showing dignitaries some of the state-of-the-art equipment they use in the disinfection of schools, markets, and other public places. The event was also to demonstrate the company's readiness to disinfect educational institutions ahead of reopening.
Human beings from far distance. So these are the drones that we use in assisting us to reach all the areas that human beings cannot walk in there. Besides this, these are also electrostatic machines. Yes, we have some over there. These machines, as soon as you start them, they are automatic. They do the work on their own. You don't need to be there, and it will work for you.
Director General of the Ghana Health Service, Dr. Patrick Abuaje, says Ghana did not record any case of cholera last year, and there was also a significant reduction in all diarrhea cases as a result of the high COVID-19 hygiene practices.
Because of the increased hygiene, because of the COVID last year, as has been mentioned, last year Ghana did not record any case of cholera. We also had a significant reduction in all diarrhea diseases, and about under 5 children who have diarrhea reduced by almost a third. And that is something we need to look at. We will continue disinfection of all schools to make the place safer as the school reopens. You can see that the kindergarten kid may want to have a red or exchange a mask with a friend, etc. These are all things we are working on. We have to make them take responsibility for their own safety and that of their family and friends in an enjoyable and fun way. So we are going to do an entertainment education program that will be coming up to ensure that we continue to educate, especially the KG and lower primary.
He says medical screening of all SHS students will be institutionalized. He has also been talking about collaborations with the Ghana Education Service ahead of the reopening of schools.
Importantly, the reopening of schools. We've been out of school for nearly a year. As part of that, we have enhanced our collaboration with the Ghana Education Service and the Ministry of Education. All senior high schools have been mapped to health facilities across the country. A few months ago, we conducted a nationwide assessment to see the conditions of infirmaries and clinics and made some national guidelines out of that. And those who do not have are clearly mapped up. And we are also working on upgrading infirmaries to ensure that those who are in school are safe and are able to respond appropriately. The medical screening for all people, all SHS people, will be institutionalized and be done annually. And that will also be including my first day in school for the newly children who are coming to school is something we need to look at. So the preschool and lower primary will be monitored as well and supported with the using currently existing school health platforms where health workers go to the school, visit, and of course we have them map up to health centers and hospitals where rapid response can take place.
The Director General of the Ghana Health Service also stated some persons who tested positive at the airport and were supposed to self-isolate did not, quote, manage it properly.
Interesting is the fact that in the last December, the numbers have been going up over the month. We started seeing an increase in October, November, and December was a major peak. We recorded 46 cases in September, 98 in October, 169 in November, and as at the end of December, we have recorded 393 cases. We are in January. In the very first few days of January, we have recorded 36, which shows that the number of cases that are coming, that would have been imported in the country, is high and would have been cumulatively gone up.
Managing Director of Zoom Lion, Gloria Anti, has been speaking about the company's commitment to disinfect schools ahead of the scheduled reopening.
The occasion is also to indicate our readiness and the partners in the pest and vector industry to undertake the nationwide disinfection of all our educational institutions and schools as they prepare to reopen on January 15, 2021. In this regard, we have procured a wide range of state-of-the-art disinfection vehicles and equipment, including 50 atomizing vehicles, 10 street disinfection trucks, 5,000 motorized spraying machines, 5,000 knapsack spraying machines, 100 disinfection drones, and 5,000 handheld spraying machines. In terms of workforce, Zoom Lion alone can boast of over 7,000 spraying gangs across the country who have been well trained with skills and the art of disinfection by the internationally recognized Noguchi Memorial Institute for Medical Research. In order to share our professional experiences, we have also established an association with a primary objective to control pests and vector and diseases through fumigation and disinfection. The association is referred to as the Pest and Vector Control Association of Ghana, which is also known as PVAG for short. This association has over 10,000 spraying men ready to serve Mother Ghana when called upon.
Maxwell Agbagba put that report together for us. You're still watching The Pulse here on the JoyNews channel. We're looking at going back to school, how safe it is, the calendar, the effects of the changes, the significant changes that have been made on the calendar. We've spoken to NAGRAT, we've spoken to a public health expert, and we've spoken to a child rights advocate.